All right, let's dive into this. Aspirin. Everyone knows aspirin, right? Those little white pills we grab for a headache, but there's a whole lot more to them, apparently.
Yeah, it's really interesting.
You sent over this video by Dr. Carlos Jaramillo,
Yes.
a Colombian doctor, and he breaks down some of the myths and facts about aspirin. And honestly, I was surprised by some of this stuff.
Yeah, it's one of those things that most people think is just a really simple painkiller.
Right.
Throw it in your medicine cabinet, you forget about it. But there's some research out there that suggests it might actually have some benefits for some pretty major health concerns like certain cancers and even dementia.
Oh, wow. Okay. I did not expect to hear cancer and dementia when we started talking about aspirin. I thought we were talking about, headaches, fever, that sort of thing.
Yeah, and that's why I think this video from Dr. Jaramillo is so fascinating. He kind of debunks those misconceptions and really highlights these potential benefits that I think most people aren't aware of. Of course, like with anything in the health world, more research is always needed. But these initial findings are pretty exciting.
So how does this little pill do all that? How does it have such a potentially big impact?
Well, to understand that, we need to kind of understand how aspirin works in the body. And one of its key actions is its ability to thin the blood. So you can almost imagine like a traffic jam happening in your blood vessels. Aspirin's kind of like that traffic cop that comes in and helps clear things out by preventing tiny blood cells called platelets from clumping together.
Ah, okay. So it's like preventing those clots
Exactly.
from forming. But wait, wouldn't preventing blood clots entirely be, dangerous in certain situations?
Yeah, you're absolutely right. There's always kind of a delicate balance there. While preventing clots can be super beneficial, for example, protecting against heart attacks and strokes, it could also, increase the risk of bleeding, say, if you were injured or having surgery. That's why it's so important to talk to your doctor before you start any aspirin regimen. They can kind of, assess your risk factors and see if it's right for you.
So it's a powerful tool, but definitely one that needs to be, used carefully.
Definitely.
Speaking of being careful, Dr. Jaramillo talks about debunking some common aspirin myths.
Yes.
What are some of those?
Well, a big one is that aspirin is safe for everyone. It's really important to remember that any medication, aspirin included, can have side effects. So, for instance, aspirin can sometimes cause like stomach irritation or even in some cases ulcers, especially in people who already have sensitive stomachs.
Right, so you wouldn't want to add to that if you're already having those issues.
Exactly. And another misconception is that aspirin is like a cure-all. So while it can be really helpful for pain and fever, it's not a magic solution for every single ailment. So Dr. Jaramillo really stresses that aspirin, like any medication, should be used appropriately and under the guidance of, a healthcare professional.
I'm starting to realize this little pill is a lot more complex than I initially gave it credit for. What stands out to you as like the most surprising thing about aspirin?
I think for me, it was the link to cancer prevention.
Uh,
It's just fascinating to think that something so, commonplace, something that's been around for ages like aspirin, could potentially have this big of a role in preventing something as complex as cancer.
yeah, that is pretty wild. You also mentioned dementia, right? How does aspirin potentially help with that?
Yeah. So there's a type of dementia called vascular dementia, and it's basically caused by like damage to the blood vessels in the brain. And because aspirin can help improve blood flow, it's thought that it might be able to kind of protect those delicate vessels and reduce the risk of that damage from happening.
Oh, okay. So it's all like tied together, the blood flow, the clots, all of it. But let's go back in time for a second. I'm curious about like the history of aspirin. Didn't it originally come from a tree?
You're right. Long before aspirin was a pill, people actually used willow bark for pain relief. And they did this for centuries.
Yeah.
And as it turns out, willow bark contains a compound that's similar to aspirin. And that's actually how aspirin was eventually, discovered and synthesized.
So ancient wisdom leading to modern medicine.
Yeah.
That's pretty cool. But it sounds like even with all this knowledge, there's still a lot more to learn about aspirin.
Oh, absolutely.
Yeah.
There's always new research coming out.
This is fascinating already, this deep dive. We've uncovered some surprising potential benefits of aspirin, addressed some common myths, and we're just getting started. Stick around, because in part 2, we'll delve even deeper into the specific risks and benefits. We'll explore how doctors decide who should take it, and maybe we'll even uncover some alternative options if aspirin isn't right for you.
Okay, welcome back to our aspirin adventure. We uncovered some surprising potential benefits, but Like any good mystery, there are always some twists and turns.
Yeah.
I'm curious to dig a little deeper into the risks and benefits.
Okay.
You mentioned earlier that it's not a one-size-fits-all kind of drug.
Right, you're exactly right. Aspirin can be a really powerful tool, but it's not without its downsides.
Hmm.
We talked about stomach irritation, but there are other things to consider as well. For example, aspirin can interact with certain medications, so it's really crucial to tell your doctor about everything you're taking, even over-the-counter supplements.
Yeah, that makes sense. It's like a delicate ecosystem in there, right?
Exactly. All those medications and things. Okay, what about the blood thinning effects we talked about earlier? Are there situations where that could be a problem?
Definitely. As helpful as it can be in preventing clots, that same blood-thinning action could lead to excessive bleeding if you get injured or need surgery. That's why people are often advised to stop taking aspirin before any kind of surgical procedure.
Right, that makes sense. Okay, so we've talked about the potential risks, but let's circle back to the benefits. We touched on heart health. What specifically makes aspirin helpful in that area?
Aspirin's blood-thinning properties really shine when it comes to cardiovascular health. By preventing those traffic jams we talked about, aspirin can help reduce the risk of heart attacks and strokes, especially in people who've already had one or are at high risk.
Okay, so it's like a preventative measure, helping to keep those blood vessels clear and flowing smoothly. But I'm guessing it's not a magic bullet. Lifestyle still plays a big role.
Absolutely. Aspirin's just one tool in the toolbox when it comes to heart health. Eating a healthy diet, exercising regularly, managing stress, all those things are still super important.
Right, it's like having a well-rounded team. Aspirin's a valuable player, but it needs the support of the rest of the squad. Now, I remember you mentioned some promising research on aspirin's potential role in cancer and dementia prevention. Can you tell me more about that?
You bet. This is where things get really interesting. There's growing evidence that aspirin's anti-inflammatory properties might play a role in reducing the risk of certain types of cancer, particularly colorectal cancer.
So by reducing inflammation in the body, aspirin might be helping to create an environment that's less hospitable to cancer cells.
That's the idea. And it's not just about preventing cancer either. Some studies suggest that aspirin might even help slow the progression of certain cancers in people who have already been diagnosed. But it's important to note that this research is still ongoing.
So scientists are still piecing together the puzzle, but the potential is definitely there. What about dementia? How might aspirin be helpful in that area?
Well, remember we talked about vascular dementia being caused by damage to blood vessels in the brain. By improving blood flow, aspirin might help protect those delicate vessels and reduce the risk of that damage occurring.
So it's like a shield, safeguarding the brain's intricate network of blood vessels. But I'm guessing this research is also in its early stages.
You got it. While the initial findings are promising, more research is needed to confirm these potential benefits and to determine the optimal dosage and duration of aspirin therapy for these specific purposes.
Right, so it's like scientists are on a treasure hunt, following the clues and uncovering new possibilities along the way. But with all this talk about potential benefits and risks, I'm wondering, who typically benefits the most from aspirin therapy? Is it for everyone?
Not necessarily. The decision of whether or not to take aspirin is a personal one, made in consultation with your doctor. They'll take into account your individual risk factors, your medical history, your lifestyle, any other medications you're taking.
So it's like a customized approach, tailored to each person's unique needs. What are some of the key factors that doctors consider when making these decisions?
For starters, they'll look at your cardiovascular health.
Mm-hmm.
Things like your blood pressure, cholesterol levels, family history of heart disease, all those play a role. They'll also consider any other medical conditions you have, as well as any medications you're taking to check for potential interactions with aspirin.
So they're gathering all the intel to make the most informed recommendation possible. Are there certain groups of people who tend to benefit more from aspirin therapy?
Definitely. Individuals who have already experienced a heart attack or stroke or who are considered high risk for those events often benefit significantly from taking aspirin. It can help reduce the risk of future events and improve their overall cardiovascular health.
So in those cases, the potential benefits outweigh the potential risks. But I'm guessing it's not always such a clear-cut decision.
You're right. For people who haven't had a heart attack or stroke, but have certain risk factors like diabetes, high blood pressure, or smoking, the decision to prescribe aspirin is more nuanced.
It sounds like a careful balancing act, weighing the pros and cons for each individual. But I'm curious, what about people who can't take aspirin or who experience side effects? Are there any alternatives?
That's a great question. There are other medications that can help thin the blood, But they work in different ways and have their own sets of risks and benefits. Your doctor can help you explore those options if aspirin isn't a good fit for you.
So it's like having a backup plan just in case aspirin doesn't work out. This deep dive is really highlighting how personalized medicine needs to be.
Exactly. And remember, even if you're a good candidate for aspirin therapy, it's not a substitute for a healthy lifestyle. Things like diet, exercise, and stress management are still essential for overall well-being.
It's like having a multi-pronged approach to health, with aspirin potentially being one part of the equation, but not the whole solution. This deep dive has definitely been eye-opening. We've learned about the risks and benefits of aspirin, how it might play a role in preventing serious health issues, and how important it is to have an open conversation with your doctor. Stick around for part 3, where we'll delve deeper into the future of aspirin research and tackle some listener questions. Welcome back to the final part of our aspirin deep dive. We've covered a lot of ground, from ancient willow bark to potential cancer prevention. Now I'm curious where aspirin goes from here. What does the future hold for this seemingly simple pill?
Well, that's what's so exciting about science, right? Even a medication as well known as aspirin still has mysteries to reveal. Researchers are constantly exploring new avenues, testing new hypotheses.
Yeah,
It's like they're on a quest to unlock aspirin's full potential.
that's a great way to put it, a scientific quest. What are some of the areas that researchers are most focused on right now?
Well, one area that's generating a lot of buzz is aspirin's potential role in cancer prevention. We touched on this earlier, but there are large-scale clinical trials underway to see if regular aspirin use can actually reduce the incidence of certain cancers, like colorectal, breast, and even prostate cancer.
So it's not just about treating existing cancer, but potentially stopping it before it even starts.
Exactly.
That's incredible. What else are scientists looking into?
But the research is expanding beyond cancer, too. Scientists are investigating whether aspirin might be beneficial in treating or preventing other conditions such as Alzheimer's disease, migraines, and even certain types of infertility.
Wow. The possibilities seem endless. It's like aspirin is a Swiss Army knife of medicine with a tool for every ailment. But with all these potential applications, I'm curious about the dosage. Is it the same for every condition?
That's a crucial point. Dosage is not one size fits all. It varies depending on the specific condition being treated or prevented. For example, a low dose of aspirin is typically used for cardiovascular protection, while a higher dose might be prescribed for pain relief.
So finding the right dose is like fine-tuning an instrument, making sure it's playing the right notes for the desired effect. And I'm guessing that's where a doctor's expertise comes in.
Absolutely. Determining the appropriate dosage is a complex decision that should always involve a healthcare professional. They'll consider your individual risk factors, medical history, and the potential benefits and risks before recommending a specific dosage.
Yeah, it's like having a personalized map for your health journey, guiding you towards the best possible outcome. But even with a doctor's guidance, I imagine some people are still hesitant to take aspirin regularly. What are some common concerns that you hear?
Well, one concern that often comes up is the risk of gastrointestinal bleeding, which we discussed earlier.
Yeah.
But there are ways to minimize this risk, such as taking aspirin with food, using enteric-coated tablets, or taking a proton pump inhibitor alongside aspirin.
So it's about finding strategies to manage the risks while still maximizing the potential benefits. What other concerns do people have?
Some people worry about the long-term effects of taking aspirin regularly, even at low doses. And while aspirin is generally considered safe for long-term use, it's important to be aware of any potential side effects and to discuss any concerns with your doctor. Open communication is key.
It sounds like a partnership, working together with your doctor to find the best approach for your individual needs. But aside from the potential risks, are there any other reasons why someone might choose not to take aspirin, even if it could be beneficial?
Well, some people simply prefer to avoid medication unless absolutely necessary. They might focus on lifestyle modifications like diet and exercise to manage their health. And that's perfectly valid too.
It's all about having a toolbox of options and choosing the ones that feel right for you. This deep dive has been a fascinating journey, and it's clear that the story of aspirin is still being written. What's the key takeaway for listeners who are considering adding aspirin to their health regimen?
I think the most important thing is to talk to your doctor. They can assess your individual risk factors, discuss the potential benefits and risks, and help you make an informed decision that aligns with your health goals.
It's like having a trusted advisor, someone who can help you navigate the complexities of health and make choices that empower you. Well, this deep dive has been an eye-opener. We've explored the history, the science, the potential benefits, and the risks of aspirin. It's amazing how something so commonplace can hold so much scientific intrigue.
It just goes to show that there's always something new to discover, even in the things we think we know well.
Exactly. And remember, knowledge is power, especially when it comes to your health. So stay curious, keep exploring, and we'll catch you on the next deep dive.